Hi, I'm Dr. Milescu. I am adjunct professor at Daytona State College Deland campus, and we are continuing our series on the landmarks, the bony landmarks of the skeletal system. So this short video is going to be an instructional video on identifying all the important landmarks of the scapula and understanding left from right scapula. So this is a great video to review before the practical. The midterm practical does include the appendicular as well as the axial skeleton. So without further ado, let's get started. So this is your scapula. You always want to look at this glenoid cavity. So the glenoid cavity is basically the shoulder socket. So basically this whole area right here articulates with the humerus to make up your shoulder joint, okay? And so therefore, the glenoid cavity always has to face laterally. So this cannot be a right scapula because as you can see, this is facing medially if I put it on myself. But if I put it behind my left side, as you can see, the glenoid cavity is facing laterally. Here's my arm. There's my humerus articulating with the glenoid cavity. So when you identify the glenoid cavity, you're able to help yourself in knowing what's right from left. But you also have to know what's anterior and posterior. In other words, what's behind, what's in the back, and what's in the front. So always remember the posterior aspect of the scapula is this spine right along here. Okay, so that's the spine. Follow the spine to its end, and you can see it kind of curves over anteriorly. And you can actually feel that, palpate that on yourself. So follow the spine all the way up to here, and that's the acromion. And how do I teach my students? Well, in the alphabet, A comes before C. So A here is on top, and then next is C. What does the C stand for? Well, that's called the coracoid process. Acromion and coracoid process. All this can be seen laterally. So there's your glenoid cavity. All right, let's turn it back around posteriorly. So again, follow the spine, that scapula spine all the way as it curves anterior. Look at the top, and there it is, superiorly and laterally, and also posterior to the coracoid. So if you look at the scapula anteriorly, and this is the subscapular fossa, you can see here the glenoid cavity sitting here up on top, superior, posterior, and lateral to the coracoid, right? So the acromion process is superior, it's behind, so it's posterior and laterally. So the acromion comes first, A before C, and this is the coracoid. So acromion, coracoid, glenoid cavity. If this is the glenoid cavity and it's always going to face laterally, this is called the lateral border. Thus, by process of elimination, this is the medial border. All right, so looking at this scapula, which is a left scapula, as you can see, there's my spine, and you can feel that on yourself, right? You can feel that spine. Follow the spine to its end, and you can actually palpate the acromion. All right, so above the spine, you have this fossa. Fossa is always a surface. So above the spine, right here, I'm going to use my little pointer. There it is. I don't know if you can see it right there. Probably can't see it on the video, but that is the supraspinous fossa, meaning above. Supra means above, so above the spine. Below the spine is the infraspinous fossa. So supraspinous fossa, infraspinous fossa. Don't forget that glenoid cavity, so lateral border, medial border. Less popular, not usually asked on any practical, but if you ever look at a figure in your anatomy book, you'll see that this is called the superior angle and this is called the inferior angle. I'm going to stick with the main parts. So make sure you know that that's the medial border, that's the lateral border. How do you know that that's the lateral border? Because the glenoid cavity always has to face laterally to articulate with the humerus, the humeral head medially, to make up your shoulder joint. Okay? So again, one more time to review, follow that spine to its end, A comes before C. Let me turn it around anteriorly. So right here, posterior to everything and superior to the coracoid is the acromion. So acromion, and then inferior to it is the coracoid, A before C. Acromion and coracoid, glenoid cavity, lateral border, medial border. Now, the only other surface I didn't mention yet, this is called the subscapular fossa. So it's literally facing my ribs, okay? So if I bring Mr. Stanley over here, if you bear with me, I will disappear from the screen for a minute and bring Stanley over. But let me review one more time before I show you the scapula on the skeleton. Here we go. The spine, follow it to the end. What is it called? Acromion. There it is. Right below the acromion and inferior to it is the coracoid process. So acromion, A before C, coracoid. Glenoid cavity, this faces laterally, so lateral border. Medial border, superior angle, inferior angle, subscapular fossa. Look at the posterior aspect of this left scapula, and we have a supraspinous, so above the spine, supraspinous fossa, meaning surface, and infraspinous fossa. All right, so that's your scapula. Hold on, I'm going to bring Mr. Stanley over. And here I am. So there you go. See Mr. Stanley? So in looking at Mr. Stanley here, he lost a lot of weight. He doesn't eat much. All right, that was a dumb joke. But here it is. Posteriorly, you could see the infraspinous fossa. There's the spine and the supraspinous fossa. All right, now look at the subscapular fossa. I'm going to turn him around and bring him really close. And right inside here, as you can see where my fingers are, that whole subscapular fossa is articulating with the ribs. So as you can see, when you fracture your ribs, you can also cause some trauma to the scapula, and that can be very painful. I've had patients that complain about that. All right, so that's pretty much the scapula. All right, so we're going to go over each video with each bone, but this time all you need to know for this video is reviewing the scapula for your practical. Good luck studying. We are week 7, closer and closer to the midterm. So